Breaking medical news. A groundbreaking study has identified a new drug that shows remarkable promise in suppressing the life-threatening systemic inflammatory response syndrome that can occur after heart surgery, potentially saving countless lives and reducing the risk of complications for patients undergoing cardiopulmonary bypass procedures. Ladies and gentlemen, today I'd like to draw your attention to a critical area of research that has far-reaching implications for the field of cardiothoracic surgery. Systemic inflammatory response syndrome, or SIRS, is a complex and multifaceted phenomenon that arises in response to the stress of cardiopulmonary bypass surgery. This condition can have devastating consequences, including multi-organ failure, sepsis, and even death. The pathophysiology of SIRS is characterized by an exaggerated and uncontrolled inflammatory response, triggered by the activation of immune cells and the release of pro-inflammatory cytokines. This cascade of events can lead to a cascade of downstream effects, including endothelial dysfunction, coagulopathy, and ultimately, organ failure. Despite our best efforts, existing treatments for SIRS have been largely ineffective in preventing its onset or mitigating its consequences. Current strategies rely on a combination of pharmacological interventions, including anti-inflammatory agents and vasopressors, as well as technical modifications to the CPB circuit. However, these approaches have been met with limited success, and the need for more effective treatments has never been more pressing. The development of SIRS is a complex interplay of genetic, environmental, and surgical factors, and a comprehensive understanding of its underlying mechanisms is essential for the development of targeted therapies. Recent advances in our understanding of the molecular pathways involved in SIRS have identified several key players, including the inflammasome complex and the cytokines IL-1 beta, TNF-α, and IL-6. The discovery of these molecular mechanisms has opened up new avenues for the development of therapeutic interventions, including the use of inflammasome inhibitors such as NuSepin. These agents have shown promise in preclinical studies, and their potential to mitigate the inflammatory response and prevent the development of SIRS is a promising area of research. In conclusion, SIRS remains a significant challenge in the field of cardiothoracic surgery, and the need for more effective treatments is urgent. The development of targeted therapies, such as inflammasome inhibitors, offers a promising new direction for research and holds the potential to improve outcomes for patients undergoing CPB surgery. The cytokine network plays a pivotal role in the development of SIRS, serving as a critical juncture in the inflammatory cascade. These signaling molecules are released in response to the stress of CPB surgery, triggering a cascade of downstream effects that can lead to organ dysfunction and failure. IL-1 beta, TNF-α, and IL-6 are among the key cytokines implicated in the pathogenesis of SIRS. These molecules promote inflammation by activating immune cells, inducing the production of other pro-inflammatory cytokines, and disrupting the integrity of the endothelial barrier. The resulting inflammatory response can have devastating consequences, including endothelial dysfunction, coagulopathy, and multi-organ failure. The discovery of NuSepin, an intravenous inflammasome inhibitor, offers a promising new direction for the treatment of SIRS. By targeting the inflammasome complex, NuSepin has been shown to reduce the production of IL-1 beta and other pro-inflammatory cytokines, thereby mitigating the inflammatory response and preventing the development of SIRS. The potential benefits of targeting cytokines with NuSepin are multifaceted. By reducing the production of pro-inflammatory cytokines, NuSepin may help to prevent the activation of immune cells and the disruption of the endothelial barrier. This, in turn, may reduce the risk of organ dysfunction and failure, improving outcomes for patients undergoing CPB surgery. Furthermore, the use of NuSepin may also have a positive impact on the cardiovascular system. By reducing the production of pro-inflammatory cytokines, NuSepin may help to prevent the development of endothelial dysfunction and the resulting increase in vascular resistance. This may, in turn, reduce the need for vasopressors and other cardiovascular support medications, improving hemodynamic stability and reducing the risk of cardiovascular complications. In conclusion, the cytokine network plays a critical role in the development of SIRS, and targeting these molecules with NuSepin offers a promising new direction for the treatment of this condition. By reducing the production of pro-inflammatory cytokines, NuSepin may help to prevent the activation of immune cells, disrupt the endothelial barrier, and improve outcomes for patients undergoing CPB surgery. The research conducted by Professor Sung-Ju Yoon and his team at Korea University Annam Hospital is a significant contribution to our understanding of the pathophysiology of SIRS and the potential benefits of NuSepin in suppressing pro-inflammatory cytokine release during CPB. In their study, Professor Yoon and his team used a swine model to evaluate the efficacy of NuSepin in suppressing pro-inflammatory cytokine release during CPB. This model is particularly relevant as it allows researchers to study the complex interactions between the immune system and the cardiovascular system in a controlled and reproducible manner. The results of the study were impressive, demonstrating that NuSepin significantly reduced the release of pro-inflammatory cytokines, including IL-1 TNF-α, and IL-6 during CPB. This reduction in cytokine release was associated with a significant decrease in the inflammatory response, as measured by markers of endothelial dysfunction and coagulopathy. Furthermore, the study demonstrated that NuSepin was able to reduce the required dose of norepinephrine to maintain blood pressure during CPB, suggesting that it may also have a positive impact on cardiovascular stability. This is a critical finding, as it suggests that NuSepin may not only reduce the inflammatory response, but also improve hemodynamic stability during CPB. The use of a swine model in this study is also noteworthy, as it allows researchers to study the complex interactions between the immune system and the cardiovascular system in a controlled and reproducible manner. This is particularly relevant as it allows researchers to evaluate the efficacy of NuSepin in a setting that closely mimics the clinical scenario of CPB surgery. In conclusion, the research conducted by Professor Sung-Ju Yoon and his team provides compelling evidence for the efficacy of NuSepin in suppressing pro-inflammatory cytokine release during CPB. The use of a swine model in this study allows researchers to study the complex interactions between the immune system and the cardiovascular system in a controlled and reproducible manner, providing a critical insight into the potential benefits of NuSepin in improving outcomes for patients undergoing CPB surgery. The potential benefits of NuSepin in reducing postoperative complications and improving clinical outcomes for patients undergoing CPB surgery are multifaceted and far-reaching. By suppressing the inflammatory response and reducing the release of pro-inflammatory cytokines, NuSepin may help to prevent the development of endothelial dysfunction and coagulopathy, two critical complications that can arise during CPB surgery. One of the most significant potential benefits of NuSepin is its ability to reduce the need for vasopressors. Vasopressors are medications that are used to increase blood pressure in patients who are experiencing hypotension, a common complication of CPB surgery. By reducing the need for vasopressors, NuSepin may help to improve hemodynamic stability and reduce the risk of cardiovascular complications. In addition to its effects on vasopressor use, NuSepin may also help to reduce the risk of postoperative complications such as acute kidney injury, respiratory failure, and cardiac arrest. By suppressing the inflammatory response and reducing the release of pro-inflammatory cytokines, NuSepin may help to prevent the development of these complications and improve clinical outcomes for patients undergoing CPB surgery. Furthermore, the use of NuSepin may also have a positive impact on patient recovery and quality of life. By reducing the risk of postoperative complications and improving hemodynamic stability, NuSepin may help to reduce the length of hospital stay and improve patient outcomes. This is particularly important for patients who are undergoing complex cardiac surgery, as it may help to improve their quality of life and reduce the risk of long-term complications. In conclusion, the potential benefits of NuSepin in reducing postoperative complications and improving clinical outcomes for patients undergoing CPB surgery are significant and far-reaching. By suppressing the inflammatory response and reducing the release of pro-inflammatory cytokines, NuSepin may help to prevent the development of endothelial dysfunction and coagulopathy, reduce the need for vasopressors, and improve patient recovery and quality of life. The development of NuSepin is a testament to the rapid progress being made in the field of cardiovascular medicine. As we stand today, NuSepin has already completed Phase 1 and global Phase 2 clinical trials, demonstrating its safety and efficacy in reducing the inflammatory response and improving clinical outcomes for patients undergoing CPB surgery. The safety data from these trials is particularly encouraging, with no significant adverse events reported in either the Phase 1 or Phase 2 studies. This suggests that NuSepin is well tolerated and has a favorable safety profile, which is essential for any new medication. The results of the Phase 2 trial are also noteworthy, demonstrating a significant reduction in the inflammatory response and improvement in clinical outcomes for patients receiving NuSepin compared to those receiving placebo. These findings suggest that NuSepin has the potential to be a game-changer in the treatment of CPB surgery, and we are eager to see the results of future studies. One of the most exciting aspects of NuSepin's development is its potential for rapid advancement to the next stage. With its safety and efficacy established, NuSepin is poised to move into larger, more comprehensive clinical trials that will further evaluate its benefits and risks. These trials will provide valuable insights into NuSepin's potential to improve patient outcomes and reduce the risk of complications associated with CPB surgery. The rapid advancement of NuSepin's development is also a testament to the collaborative efforts of researchers, clinicians, and industry partners. The development of new medications is a complex and time-consuming process, but the progress being made with NuSepin is a shining example of what can be achieved through collaboration and dedication. As we look to the future, it is clear that NuSepin has the potential to make a significant impact on the treatment of CPB surgery. With its safety and efficacy established, and its potential for rapid advancement to the next stage, NuSepin is an exciting development in the field of cardiovascular medicine.
In conclusion, the information presented in this discussion provides a comprehensive overview of the current state of research on NuSepin, a novel inflammasome inhibitor being developed for the treatment of systemic inflammatory response syndrome, a SIRS, associated with cardiopulmonary bypass, CPB surgery. Key findings from the research include: NuSepin has been shown to suppress the inflammatory response and reduce the release of pro-inflammatory cytokines, including IL-1 beta, TNF-α, and IL-6, in a swine model of CPB surgery. The use of NuSepin has been associated with a significant reduction in the need for vasopressors and a decrease in the risk of postoperative complications, including acute kidney injury, respiratory failure, and cardiac arrest. NuSepin has completed Phase 1 and global Phase 2 clinical trials, demonstrating its safety and efficacy in reducing the inflammatory response and improving clinical outcomes for patients undergoing CPB surgery. The rapid advancement of NuSepin's development is a testament to the collaborative efforts of researchers, clinicians, and industry partners. This content is the product of Intellect Cascade, a research product of Big Blue Ceiling.